It has been estimated that 98,000 patients die each year due to preventable medical errors. However, these estimates were based upon data that was collected 3 decades ago. Growing concern for patient safety prompted new studies to determine a more accurate estimation. For over 20 years, I've been working in the healthcare setting, and I can tell you that patient care is of utmost concern, but errors do happen. Today I will discuss information collected from recent studies regarding a more accurate approximation of medical errors and measures that have been taken to improve patient safety. A recent study published in the Journal of Patient Safety estimated that the updated figure is approximately 210,000 patients who die each year. The study was conducted by reviewing randomly selected medical records of patients who had been hospitalized. The researchers looked for keywords and charts to alert them of possible errors. Also, random patients were interviewed about the care that they received. Researchers discovered that the most common adverse event was infection. Some of these infections occurred from post-procedural surgeries, and some were hospital-acquired. The second most frequent cause was medication errors. Patients were given the wrong dose of medicine or the wrong medicine altogether. The effects of medical errors are of great cost to both patients and hospitals. According to an article in the Journal of Healthcare Finance, medical errors cost the U.S. $19.5 billion. $1.1 billion of that is lost productivity from missed work and lost wages. And of course, you cannot put a value on human life. In order to address the significant patient safety concerns, the healthcare industry adopted the aviation model of safety. Both industries have a stressful environment, the need for highly functioning teams, and the need for effective communication. Another recent article in the Internal Journal of Risk and Safety in Medicine mentions 2 safety models that have been put in place in the healthcare industry. The first model is the Swiss cheese model. This model is based on the idea that a sequence of events must occur in order to cause a catastrophic error. Kind of like when you stack Swiss cheese on top of each other. The holes stack up. That's what their model is based on. Each team member has the potential to make a mistake, creating a perfect storm. That's why effective communication in the team is critical. The use of checklists also improves safety. People do not have to rely on their memory. Just as pilots in the cockpit use a checklist to go down their systems and make sure all systems are a go, healthcare has adopted the checklist as well. This is a document. This is a checklist that we use in healthcare. It's called a timeout form. The first part is to make sure that you have the correct patient. The second part of the form makes sure that you have the correct part marked so that you do the correct operation of the right leg, the correct leg. The bottom is called a timeout, where the entire team has to stop what they're doing and check to make sure that they have the right patient, the right part. The doctor makes sure that the antibiotics are on board, and everybody has to sign off that that indeed is the correct procedure. So, in summary, medical errors are a growing concern in the U.S. for both patients and hospitals. Consequences of these errors are significant, and most of them can be prevented. Lost wages, patient harm, and the loss of life are examples of impact that occurs from preventable medical errors. With the changing climate in healthcare, patients should keep abreast of their health information and become involved in their care plan when hospitalized to help prevent these preventable errors. Thank you.